back to the show. Now, in July this year, Pakistan was hit by the worst flooding in history.
The UN estimates that over 2,000 people have died, over 1 million homes destroyed, and more than 21 million people are injured and homeless.
That number exceeds the combined total of individuals affected by the 2004 Indian Ocean tsunami, the 2005 Kashmir earthquakes, and the 2010 Haiti earthquake as well.
Now, $460 million is needed for emergency relief. But now that the floods have ceased to make headlines, how much of that aid is still being sent to Pakistan?
Well, one organization in Malaysia is ensuring that the people of Pakistan are not forgotten. To tell us more about the humanitarian effort by championing SARA, please welcome Project Leader Nabila Nasir, and along with her is SARA Chynoweth, International Plan and Parenthood from the Federation. Did I get that right?
That's right.
IPPF.
Welcome to the show, ladies.
Thank you.
First of all, I guess, Nabila, tell us what about this mattered to you so that you championed this cause.
Right, okay, so championing SARA stands for Sexual and Reproductive Health Awareness, but we work specifically in post-disaster and conflict situations.
Right.
And I founded the organization because I spoke to survivors of previous disasters, and I said before, money and blanket, food, milk powder, water, but I didn't think about the little things like sanitary pads,
Right.
underwear, and I spoke to survivors, and they told women from Aceh and Jakarta, they told me that pregnant women's need were neglected, and the rape cases go up, and access to family planning and rights were obstructed, and they were so afraid to get pregnant in that situation because they know that pregnant women's needs were being neglected. So when I heard about Pakistan, I said, I want to do something, but I didn't want to do what I was doing before.
Right.
I want to champion sexual and reproductive health awareness.
Right.
Okay.
Yeah.
Perhaps, Sarah, you could tell us, what the situation is in post-disaster areas like this when it comes to things like sexual abuse, perhaps. A lot of people forget that these things do happen and people are still sexually active.
Because they'll be definitely be
tragedy.
looting, and people will be in chaos, and that's where all the problems stems from, isn't it? And people just become chaos.
Yeah, 75% of all people affected by crises are women and children.
Right.
So the vast majority are women and children, and that's not, and their needs are not. Where are the men? Good question. A lot of times the men are, men are also affected, but in conflict, men are often away fighting, for example, and women are often the main caretakers of their children, so they're always with their children. But the issue of reproductive health and emergencies is that in normal times, in non-crisis times, reproductive health issues are the main killers of women around the world. And so when a crisis happens, their needs increase, and the services, access to services decreases because there's a breakdown in healthcare systems, breakdown in society, and then you have issues like sexual violence, which also increase because there's this lawlessness, this climate of impunity, anarchy. That's right. So people can try to get away with certain things, and rape does increase, which is not something that people think about when they think of a natural disaster.
That's right. So, give us a clear picture of what Pakistan is actually facing now. I mean, the floods are still happening as we speak. But what are some of the bigger things that, if let's say these things were not addressed, what is Pakistan going to face?
So right now, there's over 20 million people that were affected by the floods, right?
Yeah.
But out of that number, there's a minimum like about 800 women who are pregnant,
Okay.
and out of that number,
800,000.
no,
800,000.
sorry, that's 800,000.
Okay.
Yeah, and it's an estimate, and what, like out of that 120 will go through life-threatening complications. So what we're doing is that we want to send aid that and make sure that the services are in place to cater to their needs.
Right.
Yeah.
Okay.
Yeah. Actually, a lot of people don't realize that money is essential, but money is not as essential as some of the basic things that they need, like you mentioned, sanitary pads and all that. What's the best way of actually getting ensuring that these things get there? Do organizations like yours ensure that?
Yeah, well, this is a really, really new, like, not a lot of people are talking about sexual and reproductive health and crisis. Yeah.
Okay.
So, it's still, people are still, like, learning about what women need over there. I myself just found out, like, a few years ago.
Right.
But, yeah, so the things that we are sending are, like, clean delivery kits, to make sure that women have a safe and clean birthing environment,
Yeah.
and we're sending out hygiene kits and condoms as well. Durex just confirmed 20,000 condoms for us to send to Pakistan. So we'll be distributing it at camps and giving out at our local partner, which has SRH clinics.
Okay.
Yeah.
Now, a lot of your critics are going to come up to you and say,
Yeah.
it's,
Yes.
you know, disaster-stricken area, floods, why are you sending condoms? So
Yeah.
perhaps this would be a chance for you to explain why things like this are so important.
Right. Sir, do you want to?
Yeah.
Speak a little bit and then you can jump in.
Yeah.
So there are some basic international standards in terms of what services should be provided in an emergency.
Right.
And condoms are one of them. So this isn't just a sideline issue or something that a few people have decided that it's important. But the international community has decided that condoms are life-saving intervention. People, it prevents HIV, which can be a life-threatening disease. It prevents other sexually transmitted infections. It prevents pregnancy, which is a huge issue. When a flood happens, you don't grab your pills and run out the door. You don't grab your condoms. You just rush out and try to save your family. But then when you're displaced, you don't want to have children. And that's not just a women's issue. The fathers, the men, the husbands, they don't want their wives to be pregnant either. So there are many different layers of importance as to why we should provide condoms.
Yeah. And it doesn't stop them from, I mean, just natural disasters doesn't stop people from, you know, having sexual intercourse. This is it.
Yeah, exactly. And sometimes it actually brings people together even more because they want that connection and that intimacy.
Yeah. People find it so hard to believe. Like, really? Are you kidding?
No, I
Still having sex? Are you sure?
I can totally, I can imagine, you know, that, yeah, that it bonds people, you know, you come together and then in spur of things, you know,
Yeah.
you would need
Now,
something.
another thing that you highly advocate is implementation of MISP, or minimum initial service package. What is that?
The minimum initial service package is a set of priority activities in an emergency. So reproductive health, it's a huge field. You have gynecological care, breast cancer screening, HIV treatment. There are lots of different, the field is very big.
Yeah.
And so the idea is that you can't do everything in an emergency. And it's just not appropriate. You're not going to do breast cancer screening in Pakistan right now. That doesn't make any sense. So the MISP, the MISP, are the 5 key activities that you need to do for women's health in an emergency. And those are the life-saving interventions, and that includes, for example, condoms, HIV prevention, sexual violence prevention,
emergency obstetric care
for pregnant women.
Yeah.
What are you guys doing for pregnant women in Pakistan? I know you're putting together special care packages for them.
Yeah, for championing SARA side, what we're doing is we're planning to send 10,000. We're aiming to send 10,000 clean delivery kits,
Right.
and these kits will be given to our local partners. We have 2 local partners. One is Frontier Primary Healthcare. They have 9 clinics in rural areas of Pakistan with SRH, Sexual and Reproductive Health focus, and we're giving out hygiene kits to our other partner, Asian Resource Foundation, or and they also have an SRH focus on the humanitarian aid that they are assisting, and they cater specifically to maternal health and grief survivors and family planning issues.
Okay.
Yeah.
And how much of what you need in terms of whether it's the actual goods themselves or manpower have you already got?
Yeah. Yeah, right now we're trying to secure, we're still in the midst of securing, like, we're talking to MNCs and manufacturers of items because we need these things in volume.
Yeah.
We're packing the items in volume, like I say, 10,000 clean, like, directs have come from 20,000 condoms.
Okay.
There's a company called Cranberries in Berhad. They've already given us 10,000 pairs of gloves to be put into the clean delivery kits. But right now we're also looking for antiseptic soap and strings, plastic sheets, and items like that, items that you can see on our website to see what we're looking for. We're still, like, searching for these things.
Speaking of your website, what would that website be?
It's championingsara.wordpress.com is actually our blog.
Okay, it's a blog page.
So are you looking for a lot of this, from what you mentioned, we'll be looking for support from companies per se to provide in bulk.
Yeah.
But what if an individual wanted to help? What could they do?
Yeah.
Okay. They could log on to our website to find out about the issues, tell people about the issues, because when more people talk about it, it's easier for people like us to do our work.
Yeah.
And third, donate money. We've got accounts set up, sending money, and all of it at SRH focus. And 3, for championing SARA, we are at the end of this project. yeah,
pack it
pack,
up.
to pack
Right.
the kids, and then after that, the team, about 3-4 of us, will fly to Pakistan and meet our local partners there to do the delivery.
Is there like a center set up there for like you mentioned, pregnant women?
Right.
And,
So, like I was like, the thing that we we don't have the local capacity to do it.
Yeah.
Japanese, so
Yeah.
we engage our local partners there to do it because they have the local knowledge.
Yeah.
They know the community trusts them. But what is important is that in Pakistan specifically is that the clinic that I chose, the local partner that I chose,
Yeah.
they have 24-hour emergency obstetric care, which not a lot of organizations have.
Okay.
And they have they prioritize female health workers because
Okay.
women in Pakistan, like they can't see male health workers,
Yeah.
So these are things that people don't think
Yeah,
about.
there's the
and
whole
it makes,
cultural thing that it's
and
very
yeah, and
important as well.
and they prioritize safety, and they involve men in family planning because in Pakistan it's still the men who are holding the making family planning decisions.
Decisions and all that.
Yeah, so these two organizations, they involve the men as well in the family planning education. Yeah.
And Sarah, is that where IPP comes in? They come in and actually understand, assess the whole cultural influence versus what is needed to be done, and that's that whole delicate balance, isn't it?
It is a very delicate balance. So IPPF is a global advocacy and service delivery organization focused on reproductive health and emergencies.
Yeah.
And we have a member association, a local association that we work through called the Family Planning Association of Pakistan. And they're doing just really fantastic work, setting up these clinics, doing outreach, doing a lot of the things that Nabila just mentioned. But I think one of the most important things that we forget is that sexual and reproductive health, it's not we don't need special clinics for it.
Yeah.
Right.
Anybody who's doing health services, any agency providing primary health care should be doing reproductive health. It's not special. You can't say, we'll deal with cholera and diarrhea, but we won't deal with the pregnant women. You have to go somewhere else.
Yeah.
Any healthcare facility should care for rape survivors, provide care for pregnant women and HIV positive people.
Final question. As you go into this and you leave Pakistan in October, is the country receiving enough support from its own government? It has been criticized over and over again. What are your thoughts on this, since you've actually dealt with organizations in Pakistan?
There's been a little bit
has done quite a bit to. They've been very receptive of receiving different international agencies. They've tried to provide a lot of support. Definitely there are some limitations, but I do think that overall they have been quite positive. I think one of the bigger issues is that this was such a slow onset emergency. It wasn't Haiti. It didn't. The next day, it didn't hit, and 3 million people were displaced. This took a few weeks to sort of develop, and so because of that, I think a lot of international donors just didn't wake up at time. So the aid just didn't come in as quickly. So that's something that we really need to push for.
But the embassy, even in, I've been in touch with the Pakistan embassy here, and they've been really supportive. Like when I contacted, they've been really supportive, and Pakistan International Airlines have also been very supportive to people who want to send relief goods to Pakistan. They're trying to give out free cargo and stuff like that. So
That's good to know.
yeah,
I mean, at least at least if they are encouraging to make it easy for
people are
to get
slowly
That's right.
putting things in place. Yeah.
Great. Thank you so much, ladies, for joining us on the show. And if you'd like to find out more about championing SARA, you can log on to championingsara.wordpress.com, or you could even send Nabila an email at nabila.csara@gmail.com.
Thank you, ladies. Again, hats off to doing
For your
some